Let us say that you are a public health advocate and would like to see a tax on sugar sweetened beverages established in your community. What steps would you take? What coalitions do you think you'd need to build? And how would you go about the extraordinary work of gathering support from both the public and political figures? Few people are in a position to tell the story in such a compelling way as today's guest, Dr. James Krieger, who joins us from Seattle, one of the many places in the world that now has such taxes. I'm Kelly Brownell, Director of the World Food Policy Center at Duke University and Professor of Public Policy at Duke. Welcome to the Leading Voices in Food. James Krieger is the founding executive director of Healthy Food America and is clinical professor at the University of Washington Schools of Medicine and Public Health. Prior to that position, he served as chief of the Chronic Disease and Injury Prevention section for the Seattle King County Department of Public Health. He is a physician and expert in public health and is recognized widely for his work on policies around school nutrition, menu labeling, increased access to healthy foods, and sugary drink taxes. So, Jim, you've been a very important figure in this issue of sugar-sweetened beverage taxes, not only in Seattle, but elsewhere around the country and the world. But before we dive in with that topic in particular, can you tell us a little bit about your organization, Healthy Food America?
Sure, Kelly, and thanks for inviting me to join you on this podcast. Healthy Food America is a nonprofit organization that provides research and public education and raises awareness about issues of healthy food policy and reducing exposure to unhealthy foods in communities across America. And we're particularly interested in improving health equity in terms of diet quality and disease outcomes related to nutrition-related illnesses.
You know, and by the way, I'd urge our listeners to visit your website because it's just rich with information on these various issues you tackle, especially sugar-sweetened beverage taxes. So let's turn our attention to that issue, the taxes. So let's turn our attention to sugary drink taxes. And let me begin by asking a pretty broad question. What did it take to get a tax passed in Seattle?
Well, a tax in Seattle or any place else is not something that just pops up overnight. It may look like that from the outside, but in Seattle, as elsewhere, it takes years of groundwork to successfully develop and win a tax adoption campaign. And during those years where things are kind of quiet, moving behind the scenes, all sorts of things are happening. Coalition development is a key element of this phase where people come together from the public health sector, from the community sector, from the government sector, and figure out exactly why they want a sugary drink tax, what problem is it going to address in their communities, and how do they go about crafting a policy that meets those community needs. It also is a question of waiting for the right moment. There has to be a window of opportunity to win a policy where there's broad recognition among elected officials and the public and community-based organizations and communities that there is a problem that a tax is ready to fix. There needs to be the right people in place to make that happen, particularly leaders in the community who are willing to put some energy into making it happen, as well as elected officials who will be the champions to take the tax policy and move it through the legislative process. Yeah, and the only other thing I think that really is important in this early phase is assuring that there's adequate funding for the campaign, because these campaigns cost money to run and win, and so lining up funders, both local and national, is pretty important. But I think to summarize all that, I think you really need to take the time up front to engage with communities, particularly those communities that are most affected by sugary drink consumption and the chronic diseases that are caused by consumption, and make sure that the leaders of those communities are on board and excited about working towards this policy goal.
So do you believe there's any benefit to just having the debate itself on the taxes, irrespective of whether the tax passes or not?
I think there probably is, because in effect, having a debate on the taxes becomes a free media campaign or public awareness campaign. Whenever the tax is discussed, it inevitably comes down to questions of what are these products, why should they be taxed, and what are their health consequences? So it's a great way to raise awareness of the public in general, whether or not the tax succeeds. I think that's actually an interesting question, which would be interesting to try to get more rigorous research to evaluate what the impact of the awareness raising prior to tax adoption is on consumption and attitudes about sugary drinks.
So how large is the tax in Seattle, and what's tax, and what do you see so far in terms of effectiveness?
So in Seattle, our tax is on the higher range of the taxes that have been adopted in the U.S. at 1.75 cents per ounce. The tax is levied on the distributors of sugary drinks, and those include everything from sodas to sports drinks to energy drinks to sweetened coffees and teas to fruit drinks. The tax is generating substantial revenues in Seattle, close to, we estimate, $23 million in the first year. And so from a revenue collection perspective, the tax has been quite successful. The tax has also effectively increased the shelf price of the tax products in Seattle, almost 100%, 97% to be precise, across all beverage categories. And so the tax is performing as anticipated. We haven't had a lot of feedback from the distributors that it's been difficult for them to comply and adhere to tax collection. We don't know yet if there is much tax avoidance going on. That is something that's under consideration right now. But given the amount of revenues that are coming in, it does not seem to be a major problem. And there really hasn't been very much opposition, pushback, or concern raised either by the beverage industry or by others in our community. Perhaps because people realize that the revenues in Seattle are going to support things that people care about: access to healthy food for low-income people and support for families with very young children, aged 0 to 3, in terms of early education support.
When you talk about tax avoidance, do you mean people are leaving the area where the tax occurs and buying their soda elsewhere?
Yeah, exactly. There's concern raised that people will cross the border from any city that has a tax and shop outside to avoid tax. And while that's theoretically a possibility, any place in Seattle, from the initial data that we have, it doesn't look like that's happening much, which might be because of Seattle's specific geography. We're a city bounded by big bodies of water on the east and west, and only small areas in the north and south are connected with other communities. So there aren't that many physical borders that are easy to cross to shop in. We're seeing more cross-border shopping if we look at a place like Philadelphia, which has a border pretty much on all sides. And so I think how much of that cross-border shopping really is going to be a city-by-city consideration. The other area of tax avoidance is whether businesses are paying the tax as required, and it seems like they are.
So how are the revenues being used? And do you believe that how they're used affects public opinion about the usefulness of the tax?
Yeah, I think that for some people who support the tax, the revenue use is the most important justification or rationale for the tax, even more than reducing consumption. I think some people who are particularly concerned about health equity view the equitable investment of revenues so that they're invested in those communities that are disproportionately targeted by predatory industry marketing practices, communities where exposure to sugary drinks is high because they're available everywhere, and therefore where consumption is high. If revenues are invested in those communities to address important community needs and health inequities, then that's considered a very important goal for the taxes. I'm just going to give some examples of how the revenues are being used in cities across the nation. So I mentioned in Seattle, we're very heavily investing in providing subsidies so low-income people can have subsidized purchases of fresh fruits and vegetables, whether at grocery stores or farmers markets. Where other communities are also doing that. In Seattle, as I mentioned, we're investing in early education, providing home visiting services and subsidized childcare slots. And Philadelphia is that's their primary focus, in doing significant investments, creating literally thousands and thousands of subsidized childcare slots for low-income people in Philadelphia. Other communities are working on preventing chronic diseases like diabetes. They're doing education around the health effects of sugary drinks. They're putting hydration stations in public places or schools. They're promoting oral health access. They're supporting community gardening programs. They're supporting physical activity and recreation programs in parks and rec centers. And they're even supporting high school completion and graduation programs and support for kids going to community colleges. So it's a wide range of programs, which I think illustrates that each community knows what it needs and knows the best use to put those revenues towards.
Well, it's nice to hear the various examples, and my instincts are the same as yours, that ultimately whether these taxes will be accepted and expanded in various places will be determined by how the revenue is being used. And it's nice that various localities are doing things that fit their own needs, and it'll be interesting to see that story going forward. Now, one thing I wanted to ask, Jim, you mentioned earlier that it takes money to run these campaigns. And I'm assuming one of those reasons is because industry is spending so much money to oppose the campaign. So, what are some of the things that you've seen the industry do to help stop these taxes?
So industry is really fully engaged in all-out war against these taxes. They, I think, actually used this word, Kelly, at one point. They view them as an existential threat to their existence, and it's probably their number one public policy agenda item is to block sugary drink taxes. So they will spend literally millions and millions of dollars to oppose a tax campaign when it's launched. You know, upwards of 20 million, $30 million in any particular location if it's a big city. They will selectively use the research findings to try to make the case that taxes don't work. They will fund their own research to try to show that taxes are having negative consequences on jobs and small business revenues. They'll create what are called astroturf coalitions, fake coalitions that they provide the money for, and then put others up to be front people for them to try to suggest that there's community opposition to these taxes when any of the opposition is really being generated by industry. Perhaps most concerning is the move that they are now making to preempt taxes. Preemption means when the state government passes a law that prevents local governments from acting, in this case from enacting a sugary drink tax. And the industry is aggressively promoting preemption legislation in states across the country to try to block local governments from passing taxes.
You know, it's a script remarkably familiar because of tobacco companies doing almost precisely the same things. In the case of the tobacco companies, they had some temporary success in stalling or blocking public health activities, but ultimately they got hit big time. And I wonder whether the soda companies aren't in for the same thing. What are your thoughts on that?
I mean, I think they are. I mean, I think despite the intense level of industry opposition, interest in sugary drink taxes remains strong. And what I think we'll be seeing actually is adoption in the next few years of these taxes at the state level. So far, all the action in the U.S. has been at the local level. At the state level is immune from preemption and covers a much larger population. And therefore, the cross-border shopping issues we talked about before are more moot at that level. So I think I think just like you said, we will see continued progress in this despite the industry opposition, just like we did in tobacco. Our industry is not going to give up easy. They're going to try where they can to even repeal existing taxes. We're seeing right now as the Philadelphia primary election season approaches that the industry is inserting itself heavily even in local politics in Philadelphia, supporting council candidates who oppose taxes and opposing candidates who have supported taxes as well as the mayor. But when I talk to folks in Philadelphia, they think any efforts to repeal the tax in Philadelphia are dead on the start because people are so supportive of the way the revenues are being invested in Philadelphia, and there is no alternative revenue source to support those pre-K and community schools and parks and rec programs.
Are there unintended consequences of the taxes?
Well, I think that's always an important question to ask about any policy, this one included. One of the unintended consequences that's been brought up by both industry and by some progressives as well is whether the tax places a regressive burden on low-income households, meaning do poor people or low-income households pay a greater percent of their household income on taxes than wealthier people? And I think by definition, yes, that's going to be true. But the question is, how much is that? Is it $100 a year or $20 a year or $10 a year per household? And I think we need the answer to that question. That hasn't been done yet. We're actually embarking on some research to try to answer that question. And I think any household level effects need to be balanced by the benefits that those same low-income households receive from the revenues we've been talking about. They're going to programs that benefit low-income people, whether paying for childcare or providing subsidies so low-income people can buy food. So on balance, is the tax policy progressive in terms of allocation of more revenues to low-income communities? And I think we'll try to get the answer to that question as well. Two other areas where industry keeps talking about unintended consequences, where there's no evidence of this at this point. One is job loss. Industry claims that because sales will go down, jobs will be lost. However, the most objective peer-reviewed studies, like one in Mexico published recently, shows that there's been no effect on employment rates in Mexico, generally in the affected sectors, and data from unemployment claims in Berkeley show similar, that there hasn't been any effect of the tax in Berkeley on employment in the food sector. In terms of small business revenues and small businesses not being able to make it or go out of business, industry claims that all the time. Again, there's zero objective evidence for that at this point, but I think it merits further study, and there are studies in the field to look at that.
Well, Jim, when I introduced you, I promised people would be hearing one of the most comprehensive views of the subject that anybody could have, and you delivered. So thanks so much for joining us today, and congratulations for what you've accomplished, and I look forward to seeing even more. And again, I invite our listeners to visit your website at Healthy Food America. So thank you again.
Okay, Kelly, it was a pleasure talking with you today and talking about this topic with you.
So our guest today has been Dr. James Krieger, Executive Director of Healthy Food America. Thank you very much for listening. If you'd like to subscribe to the Leading Voices in Food podcast series, you may do so at Google Play, Stitcher, Radio Public, or Apple Podcasts, or you can visit the website of the Duke World Food Policy Center. This is Kelly Brownell.